For all the nursing job aspirants, I am going to speak today few words about how you are preparing for the exam. మీరు ఎగ్జామ్కి ఎలా ప్రిపేర్ అవుతున్నారు అనే దాని గురించి టు డిస్కస్ సమ్ పాయింట్స్ అబౌట్ రిలేటెడ్ టు ద ఎంట్రన్స్ ఎగ్జామ్ దట్ యు ఆర్ గోయింగ్ టు హ్యావ్ ఇన్ ద మంత్ ఆఫ్ నవంబర్. ఐఎమ్ గోయింగ్ టు స్పీక్. Aspirants are getting ready for, seriously getting ready. Those who are really in need of job, those who are really trying for the job, may be very seriously working on it. I think they are really preparing for the examination. So here how you are preparing is important. There is half the way, time is over. సగంకి సగం పైన టైం అయిపోయింది. ఎలా ప్రిపేర్ అవ్వాలి ఎగ్జామ్కి అనేది మన పాయింట్. ఎలా ప్రిపేర్ అవ్వాలి, షార్ట్ టర్మ్ ప్రిపరేషన్. సో ఎలా ప్రిపేర్ అవుతారు? ద వెరీ ఫస్ట్ పాయింట్ యూ హ్యావ్ టు రిమెంబర్ ఈస్ how much ever time you have. If you feel like preparing, you can achieve it. You can achieve it is a point you have to remember. మీరు గుర్తుంచుకోవాల్సింది, టైం లేదు, నేను ప్రిపేర్ అవ్వలేదు, నేను టైం లేదు, ప్రిపేర్ అవ్వలేదు, జాబ్ రాదు. ఫస్టే ప్రిడిక్ట్ చేసేస్తారు జాబ్ రాదు. సో అవుట్కమ్, ఆఫ్టర్ ఎవ్రీథింగ్ అవుట్కమ్ ఈజ్ డిఫరెంట్. సో ముందుగానే సేయింగ్ దట్ జాబ్ రాదు, ప్రిపేర్ అవ్వలేదు, సో ఐ డోంట్ నో ఎనీథింగ్, జాబ్ రాదు. సో రిమూవ్ ఆల్ దోస్ type of myths from your thinking. You first refresh your thinking. How much ever the time remains, just have an outlook of each subject. So there are 20 subjects of 3 years. It is mentioned in the syllabus for the examination to get into government staff nurses and nursing officers. సో షార్ట్ టర్మ్ ప్రిపరేషన్లో ఈచ్ సబ్జెక్ట్ని తీసుకుంటే వెరీ షార్ట్ టైమ్. నా హౌ మెనీ నెంబర్ ఆఫ్ డేస్ రిమైనింగ్ అండ్ రిమైనింగ్ సబ్జెక్ట్స్, అట్లీస్ట్ మేజర్ సబ్జెక్ట్స్ యూ నో అండ్ మేజర్ సిలబస్ ఓరియంటెడ్ సబ్జెక్ట్స్ యూ నో. డివైడ్ దోస్ సబ్జెక్ట్స్, మేజర్ సబ్జెక్ట్స్ అండ్ minor subjects, like subjects which are having less syllabus. Like subjects which are having less syllabus in entrance exam is microbiology, psychology, sociology, first aid, environmental health, nursing education, research, professional trends and adjustments, nursing administration. Remaining all are medical background, like nursing subjects, like foundations of nursing, right? Medical surgical nursing 1 and 2, community health nursing 1 and 2, midwifery and obstetrical nursing, mental health nursing, child health nursing, and nutrition. Nutrition also you can keep it in subject which are having less syllabus, but these are the major. You start with at least one major subject and one subject from the other side having less syllabus, so that you can continuously concentrate on one this side and one that side, major and minor. At least you can have that feeling that you are covering at least more amount of syllabus from the portion which is given for the examination. So when you are taking each subject, what are the subheadings? Divide number of hours for those subheadings and take, suppose example, skeletal system. Major subjects in anatomy, physiology comes under major subjects only. In that, take anatomy, skeletal system. Example I am telling, skeletal system, common skeletal system. Important points are like, you have to highlight what is important in this, what questions are going to be asked, or how questions are going to be framed in this. You should have an idea first of all about the unit and directly go to that and concentrate. Like skeletal system, bones and joints, both are going to be there. So what are the major aspects of bones and what are the major aspects of joints? Just have a highlight, key features of that unit you try to read, right? Which is really going to be asked in the question paper is always mentioned in the a unit review or key points of that unit. So see that you will read those points at least. If you do not understand, go in depth into the point. So if you do like that, one day or within 2-3 days you can finish anatomy physiology. How is that physiology and physiology outcome, like some measurements or the normal values, specific and focused points in that particular physiology you have to pick up and study. So instead of reading the whole chapter of 10 pages, you read the highlights or focused points or key points of that unit. Nowadays tools are available, internet website access is almost there, every student. So go to ChatGPT or AI and ask ChatGPT, AI tool, AI, what are the key and important points used for MCQs for an examination. So it gives all the important points. Just go through. If you do not understand anything, open the book for clarification. Since you are running short with the time that is given for the examination, almost half is over, like this you can try and see. So one is use ChatGPT or AI and get the content, or some books are given, some publishers are given with content and key features of that particular unit. Read those points and try to answer MCQs which are there for those topics, so that you will at least have a refreshment about the knowledge which you have already had about the topic. So muscles also, muscles, how many muscles, which muscle is meant for what kind of function, specific aspects of that particular function, like significant features are present for something in our body or some muscles in our body. So those points you grab and have an idea. So prepare each subject, even medical, surgical, nursing. Take example pain scales, like example respiratory diseases, certain specific clinical features. Respiratory means there will be respiratory sounds. Commonly we get confused. Commonly known things in respiratory system is about the respiratory. As we auscultate the patient, what are the different sounds? These are the basic knowledge we require, right? Different sounds we need to know. So in inspection, palpation, percussion, auscultation, like focused points you will get. And treatment, especially respiratory treatment is different. What different treatments you have, what diagnostic procedures we have, all that, just at least a definition. And normal values. And respiratory system is like some oxygen deficiency, like oxygen problem will be there. Like that, all the types of oxygen administration. Like that, each system if you take, there are certain specific focused points will be there. Have an idea about what is common in that particular system and focus on that to have some grip about, amount of grip about the unit and the topic mentioned. For each unit, for each subject, what are the important questions expected, or what are the important topics of that unit you have to first, what in that list of subtopics also you have to take out what are the important topics. So don't ever go without knowledge of those points, so that the important things are known, so that the basic things will be known to you. So see that you will always have this kind of split and understand and try to interpret the knowledge and have connectivity of the subject. So though you are reading few points about the unit, you should have the connectivity knowledge. That interpretative knowledge and connectivity knowledge you have to gain as you prepare. Then how many subjects? Almost anatomy and physiology. Anatomy is location, size, shape, anatomical structures, like that it is mentioned. And physiology, like physiological aspects, generally specific function and its terminology you must know. And in microbiology also, like which agent causing which disease, that you should know. like some kind of diagnostic measures for certain diseases, like example tuberculosis, AFB staining, like that. One particular disease is specifically diagnosed with a specific diagnostic measure. So for like that, you have to focus on all over microbiology, psychology and sociology. What are the common things focused for examination? You have to see foundations of nursing. Most of the time, all the nursing procedures you have to be very like nursing care part, as like fever. So what nursing care, types of fever, like that, like your interpretative knowledge as well as your knowledge for implementing interventions also. Sometimes questions will be asked. And first aid. So like in case of first aid, like example procedures, specific procedures like burns, how to calculate the burns, right? Sources of burn, and shock, types of shock. Then like immediately when you see, you have to understand and rescue the patient. Like focused aspects of each aspect of topic covered under first aid. You have to, like fainting, syncope, sometimes patient collapse, there you need to give CPR. So CPR, how many breaths per second, how many compressions per second, like this specific and focused points you have to note, and take the green highlighter and highlight the points which is required for remembering. And medical surgery, nutrition, nutritive values of which kind of patient is given which kind of nutrition, which kind of patient is not to be given which kind of nutrition, like restricted for that diet, how many vitamins, how many minerals, right, how many calories required for different age groups, right, and where restricted means how it should be restricted. Different diseases, like specially focus on therapeutic aspects in nutrition. Medical surgical nursing 1 and 2 is mostly of disease condition. You should always know the definition. Specific causes, generally fever, you may be knowing infection. Specific cause like septicemia, fever with septicemia, like what kind of organisms cause septicemia. Like that, specific etiological factors you should know. Right, general etiological factors, risk factors, okay, but specific features, specific, like yesterday cancer, esophagus we have seen, Barrett's disease, right, risk factor is like having alcohol and smoking, this we can expect, but Barrett's disease nobody guess the answer. Barrett's disease is one of the reason for cancer esophagus. Like that, specific causative factors are there for a disease that you should remember. Specific clinical features are there that you have to remember. Special focused nursing interventions, like to check for the viability of the graft done in cancer esophagus surgery, surgical management. First 12 hours they should check for the viability. Like that, specific interventions. First 12 hours we have to check for vital signs, for manifestations of infection, that is alterations in vital signs. Like that, for any disease condition, there are specific nursing intervention. Routine is different. There are some points which need to be remembered. So for all the clinical oriented subjects, focus on specific etiological factors, specific clinical features, specific changes which is given a specific word that you have to remember. And even drugs, commonly respiratory system means you know, and asthmatic drugs, right, decongestants, what is that, cough suppressants, like that. So try to learn those categories of drugs used in that particular system, and nursing interventions also focused. Rest of the subjects like CET and all, what is asked in the syllabus, at least have a glance and see. Research, professional trends and adjustments, here you have to code of ethics, you have to, who is the regulatory body to give professional conduct, professional codes, right? All that the basics you should know. For India, who is there for handling the professional body, what are the professional activities, hierarchy in councils maintained, so which state have which council and how the councils are governed by the state and central government. All those few basics you should have the knowledge, and ethical aspects, legal aspects also don't forget to learn. And in ward management, how many patients, how the ward, for ICUs, for general wards, for children, for adults, for male, for female, teaching attached hospital, non-teaching attached hospitals, for how many population, how many hospitals. And even in especially community, I want to say few points you have to remember: which year what happened, which year which vaccine invented, which year the disease is announced as it is no more, which disease is now in existence, what is most prevalent, what is the most prevalent disease and most prevalent infection for children, adult, and any specific things noted for adults and elderly population. All that you have to learn, and especially what is that 5-year plans, right? And it's like time, which year to which year is which plan. Committees, which committee worked for what aspects. So that you have to specially learn. And some agencies, governmental, non-governmental agencies. What else? Disaster, about disaster management. Specially focused aspects of community. Nowadays what problems are going on, and in connection to that what type of questions are going to be expected from the subject. You just guess and just read and have proper knowledge about that. Nowadays disasters, knowledge about disaster management is much more very important. So have some knowledge about this. All these are about the subject. When you study with the short period, within short period, if you want to prepare, split the subject, give a focused time about the focused aspects of the subject. You cannot now open and read the whole book, and only reading MCQs you will get knowledge is not correct. Why? Because knowledge is given in the book only. So as you go through the textbook, you will be able to answer all the questions asked in the MCQs pertaining to that particular subject. This is my concept where I have used it. Study the subject so that you chase any question, you answer any question. If you do not have thorough knowledge, you will not be able to answer many number of questions. You may answer with all guessing, but you may not be able to answer many number of questions. Have knowledge, then answer. It becomes very easy and you will be able to score more marks. So if you have 1 or 2 hours, if you are using for answering MCQs and seeing and practicing MCQs, it is good. Okay, it is used for the practice. But another side, what you are supposed to do is read the subject. Though it is very short, try to concentrate and read the subject and try to understand the subject. Then answer. There will be lot of improvement. You can yourself can check at which part of the preparation you are able to answer the question. Without reading the content, you will not be able to score much. When you have some knowledge about that topic, answer the questions, you will be able to answer. Like electrolyte imbalances, take example. All about electrolyte imbalances, about normal values, specific features, which condition gives which complication. Like this, some focused aspects have thorough knowledge. Answer MCQs related to electrolyte, 100% you will be able to answer because already you have knowledge. I wish every aspirant will be able to follow at least for coming days. You sit with number of textbooks. If you don't have, you try to take from someone and read and give it back, but try to have the content from textbook. GNM or BSc basic nursing textbooks are there. You just go through the knowledge about that particular subject, and even ask AI if you don't have any access, though you are in duty, you are just taking some break, you can utilize that particular grab the time and prepare yourself, ask AI. Simply wasting seeing reels and wasting time. Instead of that, you can just very well prepare for the examination, asking AI give the focused points or special important points for examination, which can be asked as MCQs. Ask particularly, you give that prompt and you will get the necessary data or sufficient data, so that you will be able to get the information from computer and read that particularly, and so that you try to understand and answer to the questions. And I want to give you some tips about how to answer an MCQ. How to answer MCQ is the first one. Answering MCQs, one is read carefully. Read carefully. So the question should be, when you are practicing itself, you try to follow it. Read the question carefully. What is asked, you have to get in first. And second thing, answer the question without seeing options. What is your answer? It shows it reveals that the knowledge you had already have about the topic. And third one, look into the options, and look into the options so that you will read all the 4 options. You had already knowledge about answer, and whether that answer is there or not, you will be knowing while looking into the options. So that answer which you know and which is given in the options, if it is matching, that is consistency. See for the consistent option. Then fifth one is delete the options. Delete the options. Delete the options wisely. Like when you are consistent with the knowledge what you had will be the answer, and as you try to delete also, what you have to do is, first is which is opposite to the answer, delete first. Which is confusing you, delete. Which is near to the answer but it is not the answer, if your mind says, you delete that. And remaining answer, the option is the answer which you have answered without seeing the option. So these are the few tips. If you can follow, you can very well answer to the MCQs. So try to follow. I wish you all the aspirants, almost 20 days is left for your examination. So see that you will prepare in at least 19 days all the subjects, focused points, important points, and practice also MCQs using these tips. And more than anything, don't ever feel negative about how to get into this job, especially those who are appearing for the examination with all their frustrations, job life, family life, with all frustrations. You may not feel like getting into positive thinking, but it is most essential to feel positive, to sit and prepare and sit and write the exam and chase the race. I wish you all the success for the coming examination. Thank you.